Hi, I'm Dan Djuric. I'm a health analytics consultant here at Carilion Clinic.
So Dan built a freestanding workflow management system for the care coordinators with no additional cost to Carilion, using existing infrastructure over the course of 3 months by himself while doing his regular job.
A care coordinator works as part of our medical home team with the family practice physicians, and we help to coordinate care for patients, help them transition from hospital to home, and we also help them to learn to self-manage their chronic conditions. We have a lot of patients who are considered high risk that we need to have multiple touches with and multiple follow-up calls.
They used to receive a report every day, which listed the discharge from the Carilion hospitals. Using a manual process, pen and paper, Excel spreadsheets, they would merge that new list of discharges with the patients that they were already following, and then determine, well, who do I call first? When do I have to call them? Do I call them tomorrow? Do I call them next week? And things along those lines.
It involved a lot of administrative work that got in the way of patient care.
So we asked if there was some sort of electronic means that we could use. So Dan came through with this new transition tracking tool that we call T3 today, and we asked and he delivered.
It uses a risk assessment to identify patients who are at highest risk for a negative outcome, and prioritizes them for the care coordinators to outreach to.
We want to prioritize which ones are most likely to come back to the hospital. We want to prevent that, so we prioritize those, and we're going to schedule the calls based on that. As I've been told, it's saving about an hour every day for each of the care coordinators, and that gives them the opportunity to call another patient or two every day, make sure they're doing all right, and make it less likely for them to come back. I think that's the biggest benefit so far.
We have actually been able to intervene with some patients and provide a nursing intervention to keep them from having to go back to the hospital.
We have anecdotal evidence right now that there is a significant impact to readmissions.
Dan is the brilliant mastermind behind this transition tracking tool.
Dan is a wizard. We ask enormous things of him, and his casual response is always, "Yeah, we can do that."
He just delivers whatever it is that's asked of him.
He's committed to perfection, and it is an admirable trait.
I'm Dan Djuric, and I am Carilion.